Initially, I was kind of in disbelief that kids could have a full-blown addiction by the time they were 13, 14, 15 years old. By the time they got to me in a treatment center, they were pretty far down the road. I wanted to do something that worked. I got tired of seeing kids not make it. I believe it was in 1985, Wellborn Hospital started what was called Mulberry Center, which was a mental health and addiction treatment facility, and they needed a medical director for the addiction treatment program. I volunteered to do that alongside my office practice, and pretty soon I had 2 full-time jobs. The treatment we offered to young people didn't help very many of them because they just weren't ready. That was one of the things that led to starting Youth First. I looked around the community to see what people were doing, and the things that were popular in those days were Red Ribbon Week, scare tactics, lock-ins, speaker events. And when I went to the library and started researching effective prevention, those were all on the do not work side of the coin. Eventually I came up with a monograph from the National Institute of Drug Abuse, and it was about evidence-based prevention. And it just struck me, if we're going to start somewhere, that seems like a good start. The mental health professionals in the schools are part of that school's family, and the students do not feel a stigma attached to going and talking with that individual about any kind of problem. So they really are a trusted individual that someone can talk to without being judged. There are no barriers to care. I think that's another thing that I felt the need to overcome was access. We've saved thousands of lives by being there and readily available, readily accessible. I think Youth First exists to provide a systematic approach to prevention and early intervention for all kids, regardless of race, color, creed, socioeconomic status. I think it's the best thing I ever did in my life. I feel like I've made a difference. I think my mom and dad would be proud. It makes my heart feel good. It makes me feel like if I die tomorrow, I did okay. It's really something else to see what's happened to the organization as far as the growth and the way that it's being received now in schools. It used to be push the door open to get in. Now they're calling us, say, please come in. And it's a whole lot easier to work with partners that see the need for your help. I think we're just beginning. I don't think we're where we need to be. We're certainly not as deep as we need to be, not as wide as we need to be, but I think it can be done. When you build a stronger foundation, the whole house comes out better. Give a man a fish, you feed him for a day. You teach a man to fish, you feed him for a lifetime. And so if we can build skills and resiliency in our kids and support those skills and resiliency as they grow and develop, they're more likely to be healthy and successful children and adults.